This patient's main concern when she came in was she felt that the lip presented longer and thinner than it should. She is on the younger side. She's very beautiful. She's I'm just going to focus on the imagery of around the mouth today. But she felt like the length of the lip really drew attention away from some of the other features. If you look closely, you can see she had gotten some fillers in the past that tried to increase the volume of the red lip and define the board of the lip. But in some ways what this did was accentuate how long the lip was and how narrow the red lip presentation is relative to the rest of the lip. If you look here and you look at the shape of her lip, she already has a little bit of a triangulation or an A-frame of the lip to start, where she has more prominence of the central red lip than out here laterally, and this lateral portion kind of hoods down. If we did an isolated subnasal lip lift or standard lip lift, you can capture some of this length here, obviously centrally, but you're really not addressing the corner hooding. In a case like this where someone's already a little bit triangulated, a standard subnasal lip lift can actually accentuate that triangulation as a standalone procedure. This is a great case to do kind of a more conservative central shortening and actually focus more aggressively out here laterally. So this is a good drawing of both subnasal lip lifting and corner lip lifting. You see the modification of a standard bullhorn subnasal incision here, where you have, in this case, it's really laterally based. And what I mean by that is that very little is taken centrally, and there's a bigger emphasis on reduction of the length lateral to the midline. So you see how this captures more skin out here than it does centrally, really corresponding to the way that she presents with more length visible out here laterally than centrally. This, and I think there's a better photograph here, this is what we drew for her corner lip lift, where you see the incision's going to follow the vermilion border, or that junction between this portion of the lip and the red lip, and you're going to capture some of the skin that's causing that hooding that we looked at beforehand. And this is all really prime real estate in somebody's face. But if you close these well and you design the incisions well, it really heals incredibly well, where typically you're hard-pressed to see the incision. I think in terms of scar management or incision management, this is all about tension control, just like really any lifting or rejuvenation surgery. So the layer that you elevate the tissue and the way you manage the advancement of the deep tissue, just like when we talk about face and neck lifting, is really the priority. We use a particular type of deep sutures spread out across the closure here in order to take all the tension off the skin closure. You actually don't use those deep sutures here because it's such a thin layer of tissue being advanced that you don't want to create lumps or bumps or long-term irregularities deep to that closure. And if you get really good skin eversion or closure of the skin layer, this heals incredibly well. So this is, I think, 10 or 12 days after the procedure. So the sutures were removed about a week before this. And you still see some redness. You still see the ointment that we have patients apply after surgery. But you can see that the incision is hidden in that crease, right in that subnasal shadow. And then you also see that this closure line, even though it's only been 10 or 12 days, is already sort of fading. And the corner lip lift really heals beautifully. It's if it's designed well, it really does capture that lateral hooding. You can see how all that hooding is gone, and there's this nice shape and contour of the red lip as it moves from the corner up to the cupid's bow and back to the corner, instead of having that kind of hooded, shadowed look out here laterally that looks heavy. So this is not about extreme shortening or creating the shortest or most prominent lips. It's really just about facial balance. This lip no longer looks long. It doesn't look thin anymore, but it presents as a more balanced lip without that heavy appearance, especially in the corners. Lip lifting in general in the last 7 to 10 years has really grown in popularity. Corner lip lifting is a little bit behind standard lip lifting in terms of popularity, but what we see is The rise of lip lifting came when people were doing quite a bit of lip fillers in order to achieve bigger lips, and maybe not the best candidates, people with long, thin lips. And shortening the lip was a better option for presenting the lip in a better way. And so lip lifting rose because of that. And then lip lifting has become quite popular, but a lot of people were neglecting the corners. And so you'll see a lot of people with that triangulation after a lip lift. So now corner lip lifting is rising to meet that sort of demand of trying to optimize the balance of the lips. Because again, if you, in the right candidate, when you do them together, you can get that nice balanced lip. But sometimes a subnasal lip lift alone isn't enough to get that contour. The whole goal is to create a really balanced, youthful, and pretty but natural look to a lip. And sometimes that's one isolated small procedure, sometimes it's a combination of procedures. Like with all surgery, you want to have as many tools in your tool belt as possible. Lip surgery is at a point now where we can really tailor the type of surgery to each individual's anatomy. If you measure things well, you analyze, you have a good aesthetic sense, and you're in agreement with the patient, you can really create incisions that blend perfectly and create an outcome that looks really balanced and appropriate for that person.